First is a dashboard that we implemented in our inflammatory bowel diseases clinic. Our pharmacist in that clinic had been noticing that patients were having gaps in care because they had outdated labs. The clinic protocol in that clinic is that patients have to provide monitoring labs at certain intervals, and if they have not completed those labs, they will not be able to get their prescription refilled. So the pharmacist wanted a way to identify those patients who were at risk of not being able to get their medication because their labs were outdated. So we created a dashboard that would help the pharmacist identify patients who had no refills left on their prescription and would need safety monitoring labs before they could get their next refill. This allowed the pharmacist to then intervene with the patient and give the patient more time to complete that monitoring before they ran out of medication. And we did test to see if this dashboard was effective, and what we found that when we looked at patients who had outdated labs pre and post implementing the dashboard, the number of patients, or the percent of patients with gaps in therapy, went from 80% to 32%. So it was definitely giving patients additional time to get that monitoring done. Definitely helped them be able to stay on medicine. So proactively anticipating problems really made a big impact for those patients. That's one example. The other example is when thinking about cost avoidance and impacts that we can have on cost. In our oncology clinic, we implemented a pharmacist assessment whenever patients needed a refill renewal. So that's when a patient has no refills left on their prescription, and they're going to need a new prescription so that they continue on therapy. What we did was we implemented an assessment where the pharmacists are specifically looking to see if the patient has any kind of upcoming appointment, labs, or follow-up that could change their therapy. And do they have enough medication on hand? And if that's the case, then instead of requesting that refill from the office, the pharmacists are waiting. They're waiting. They're pushing off that refill renewal until after the patient has their follow-up. Then they're checking back in after that follow-up to see if it is appropriate to ask for a new refill for that patient. And what we found in that quality improvement project was that pharmacists postponed about 8% of refill renewal requests. Of those that they did postpone, 98% resulted in some kind of change after the patient had their follow-up. And that equated to over $550,000 or around $550,000 in cost avoided if those prescriptions had been filled. If you're looking at WAC pricing, it's more like $750,000 if you're looking at AWP minus 20%. So it really depends on your audience as to how much money is being avoided. But by taking that initiative to look to see what's going on with the patient instead of just sending a refill request to the office, we're able to be, really selective and really make sure that medications are not being refilled that are not going to be used. And really takes the burden off the clinic staff as well, because as the specialty pharmacy, we've got insight into the prescription filling history of the patient, and we know how much medication they have on hand and whether or not they should be able to make it until a follow-up. I think that technology is really going to help in a lot of areas of specialty pharmacy, but I do think in patient monitoring and care coordination, we can really tap into technology as it evolves to help us take care of patients. These medications are really complex, and it is, really hard to get patients initiated on therapy, and it's really hard to coordinate them staying on therapy, especially when it takes multiple entities and multiple providers to take care of those patients, and there's very little transparency. So I think that is where technology will really come in and help us. We need to automate things as much as possible and create safeguards so that these patients don't fall through the cracks when it comes to their patient monitoring and their care coordination, and they don't experience gaps in care or not being able to stay on therapy because a step that needed to be performed wasn't performed.